conservative, but I'm very uncomfortable with the government running anything. I'll just be honest. Like, I do believe in a hybrid system. When you have Germany, France, Japan, Sweden, the UK, Canada, all of these people have different versions of socialized medicine. We can find one that works for us. We're that creative. We have intelligent people. We keep using the excuse that we don't want to be like Canada, as if we don't, is that the only model we must follow by some law? We can create our own model just like New Zealand did. So why don't we think about doing that? And I do believe in hybrid, because I think people should have a choice, you know, and in New Zealand, they do. They have the socialized healthcare, but they also have private insurance for people. So there was an American ER colleague, a family of 4, and I think he was paying about $600 a month for his private insurance on top of what they had with the socialized med. For $600 a month, I was paying that by myself here. Okay. And that's what he was paying for a family of 4. And he said, it's worth it for me. And the care is really good quality. We're more advanced with a lot of our tools and stuff, but the actual medicine, like what they have in Germany and everything, is totally, in France, they're equal. So we can't say that it lowers the standards.
Yeah, I agree. What I would say that I agree, one thing I'd throw up at Randy is how's Amtrak working out in the U.S. postal system?
You misunderstand me.
If you want to get into a governmental argument,
you misunderstand me.
No, well, let me finish.
Right.
So if you want to get into a better standard of healthcare, then if you want to have the rail system, like I just read, they want infrastructure, don't give me Amtrak back. I don't want it. Leave it up in New York and Philadelphia. If you want to bring me a rail system, give it to Elon Musk and let him develop it. Let those guys do it.
Couldn't agree with you more.
Yes.
Look who's going to take us to Mars.
The medical side, I think you have to, I agree, it's got to be people get covered and you have to have that. But I don't want anything coming out of Raleigh, where I live, or Washington. Don't trust them. And if I did trust them, let me go one more step. If I did trust them, then why is Dr. Natalie going to New Zealand? Here's somebody who's been tied to the government.
Well, that's why we're having the exit interview. We want to know how to fix it.
You know what? Yeah. Natalie also said another really important, there's a really important, simple concept. You can't take away people's creativity. You can't stifle them. We have so many brilliant minds here at work. And so when you take that away from people and their ability to solve issues like this,
right?
You're right. We shouldn't be looking at one system to emulate. We should look at what works. Look right here and there.
That's right. And just look at what's positive or who's doing it right, and then take certain aspects of those. I'm not in that world. It's just common sense. But sometimes we just let so much cloud the picture that's unnecessary. And with medicine, I think, to me, it's logical. If you keep the patients happy, they come back and they bring their money with them. Okay, so when you bring in the business and you say, well, we're going to lock you, and they're going to take a hammer and hit you over the head and say, this is how we're going to run the business. We don't care if the doctors are happy. This is how we're going to make money. Then yes, you're going to make money, but you have a lot of angry people around you and unhappy people. And then they start exiting. And when they start exiting, you lose your ability, you lose your options of making money from those qualified people anymore. And unfortunately, what's happening in ER right now as we speak is the corporate management groups, the CMGs that hire most of us, have started their own ER residencies, creating their own automatons, which our umbrella organizations did not staunch that. A lot of us on the front line, the worker bees didn't know it was happening. So now the estimate is that there'll be an excess of emergency physicians in 2030. And so just so you know, when I started looking 3 years ago, here's the thing about using your own brain and mind about what's happening and not being reactive but proactive. I saw the compensation dropping. I'm in California, which was always a shitty paying state. Okay. It always was a crappy paying state, in my opinion, for the cost of living. But I saw the compensation starting to drop. And I didn't know why it was dropping. But what that tells me is that they have more selection. The competition maybe isn't as great. You just have to pay attention to what's happening in the climate. Certain areas pay well, like the Bay Area and so on. But to get in the Bay Area, people have to die and open up a spot. They don't leave, right? But I can find a job in in the Central Valley where Stockton and Modesto and all that, because nobody wants to go there, right? So you can go there and make good money, but you're not really happy and so on. But anyway, the compensation started dropping, and that was, to me, the first sign. I was already unhappy and making the decision to leave, was looking at the Cayman Islands and Bermuda and Guam and all of these places. And then when they didn't want to negotiate with me anymore, and I know what kind of package I bring. I know my package is a good package. It's a gold standard. It's what they want. But they're deciding that they're going to go down another path, because now, first of all, I've never bankrupted one hospital in my life. So every time they want to haggle about paying me, I said, I've never bankrupted anyone. And that piddly money I'm asking you is still not more than what the administrator's making, and he's not saving any lives. So I don't want to haggle over this, you know, but I'm mad because our umbrella organizations, if I saw it and I'm like, I'm a worker bee, how could they not see it happening? And how did they allow corporate medical groups, which is a total conflict of interest, because they're bringing in doctors and they're going to create, to me, a metric style model of cookie cutter medicine and create doctors or automatons that follow that.
Well, we always come back to, Natalie, when we were talking about solutions, we always come back to Mayo and Cleveland Clinic. Mm-hmm. Now, as physician run, kind of everybody taken care of, and they're streamlined, and the costs are kept at, I mean, mm-hmm. Cleveland Clinic had gotten coronary bypass down to such a cost that Lowe's corporate center in North Carolina flies their patients to Cleveland to get cardiac care, except if you're dying. But if you've got elective valve surgery or anything else, it was still cheaper to go through contract there. But I was wondering, so we talk about that, our groups, and we're in the Southeast. What do you think about Kaiser? Is Kaiser just a giant HMO, or is that just, okay?
I worked for Kaiser for 8 months, and listen, I'll be the first to tell you that I whore myself out, okay? I'm my own employer, and I'm my own pimp and prostitute, and I'm proud to say that, okay? So I don't like them being my pimp. I decide who I want to work with, and then we screw each other. We don't like it, but we both make money, and they go their way, and I go home and take a shower. You know, so I worked for Kaiser. I knew it wasn't going to last, but they were the best paying in the area, but they're totally metric driven. Yes, it's physician owned, and all of that is a selling point as far as I'm concerned, because the way the system is run, you have so much time to see patients, and the doctors who work in the primary care part of Kaiser will tell you that this is how much time I have to see patients. That is metric driven. Mm-hmm. Okay, so the ER, even though they only hired board certified ER physicians, which is fantastic, I told them, I said, I don't work high volume, so you might not want to hire me. They're like, no, you will. And I just like, because you only have to see about 11 patients in 8 hours. Well, I can do that, but my eyes closed. Like, that's nothing. That's like 2 patients an hour. I'm used to that. Well, they didn't tell me I had to see those 11 in the first 2 hours. Okay. And that it really is a volume based kind of thing. But the money's internal, right? That's why when you're working in the ER and you're working in another hospital and you get a Kaiser patient, you've got to call them and get that stupid Kaiser number of approval while I'm in the middle of the emergency, because they need approval to approve. And I don't even know how they got the hospitals to do that, because technically that's like illegal, right? Like, you can't ask somebody if they can pay when it's an emergency. But Kaiser wants you to get an approval number so that they approve, and you have to talk to a doctor and say, I got this septic patient who's really blah, 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 yada, yada. And then the doctor says, okay, well, go ahead and keep him there, and we'll, that's fine. And then it's approved, and I get approval number, and that person is paid for. I should not have to do that, right?
I think you're
so no, Kaiser's not on my favorite list, and I don't care that they're physician owned. I don't care. They're practicing like business people who don't give, but they do provide good primary care. My parents have them. I'm okay with that. I like the primary care because they do practice preventative care. They actually do that. And that's because they don't want to pay for sick people. It costs a lot.
And so that's reasonable.
That's their incentive. And I'm okay. I don't care about the incentive. They're doing a good job.